Ongoing violent protests hampered healthcare at some hospitals and the rollout of vaccinations in Gauteng and KwaZulu-Natal. COVID-19 vaccine rollouts in Gauteng and KwaZulu-Natal were brought to a halt on Monday after centers were advised to close their doors because of unrest and looting in the two provinces. And in some cases, vehicles delivering critical oxygen supplies for COVID-19 patients were turned away. Now let's discuss this further. We're joined via Zoom by Life Healthcare CEO Peter Wharton-Hood. Mr. Wharton-Hood, thank you so much for your time this afternoon. Now, how has this unrest affected the country's fight against COVID-19, particularly your hospital?
Well, the impact has been calamitous. Our hospitals were stretched to the limit with the spike in COVID-19 cases before all the unrest began. We had doctors, nurses, clinicians, healthcare workers working overtime in very difficult circumstances. Now the unrest has compounded that and made it even more difficult for us to continue the fight against the virus. So in one word, it's been calamitous for us.
Now, one of the reasons that we are in this extended lockdown level 4 and where certain restrictions have been tightened was to prevent just the uptake in terms of trauma cases in hospitals. Talk to me about what you've seen in terms of your trauma units as a result of this unrest.
Well, when lockdown 4 was implemented, we did see a reduction in casualty-related A&E admissions, as was to be expected. And that capacity had been filled up with COVID-19 patients who were effectively waitlisted inside our A&Es, waiting for beds to become available in the facilities. Now with the unrest, we have stabbing victims, we have looters arriving in our hospitals for treatment, and of course we don't turn them away, we treat them. We've had security forces with gunshot wounds arrive in our facilities for treatment. So the capacity that was created to deal with COVID-19 patients is now being absorbed by unrest victims in KwaZulu-Natal that are now filtering into our facilities. So that whole reprioritization that we took in the interests of our country have now been effectively laid to waste by the unrest and the challenges that has caused for us.
All right, Mr. Wharton-Hood, thank you so much for your time. This is where we unfortunately have to leave it as we continue to look at just some of the looting and the violence that is gripping our country at the moment in those two provinces.